And now it's my honor to present Dr. Omar Alelwan from Jordan. He's a gynecologist in the United Arab Emirates, and his lecture is about gestational trophoblastic neoplasia. Dr. Omar.
At the beginning, I want to thank the organizing committee and the scientific committee for inviting me here. And of course, always I want to thank the audience who stayed at the end. This one is, this one next? Okay. As you see that most of the people here and our doctors, we are trying to represent the data of real data for MEMAGO region. All of us saying that it is difficult to collect this data. Actually, what am I going to say? I am going to talk about the rarest one. So most of our doctors here, if they have any published papers, most of them, they didn't write anything about the GTN. So you know how much it will be difficult for me. It's not going in. Okay, I have no disclosures. As we know, gestational trophoblastic neoplasia is a malignant form from gestational trophoblastic disease. It includes the invasive mole choriocarcinoma, placental-site trophoblastic tumors, and epithelial trophoblastic tumors. And the choriocarcinoma has two different significant types, including gestation and gestational, and the placental-site trophoblastic tumors is a rare form from GTT also. Actually, the exact cause of gestational trophoblastic neoplasia until now it's unknown. And according to the studies, most of the studies, as we can see, that it's more frequent in Asia than other countries. For example, in Japan, it's around 3.3 per 40,000 pregnancies, and Southeast Asia, it's reached about 9.2. If we come to our MEMAGO region, I have one comment in here. I cannot see Jordan. Jordan is one of the Middle East countries. So we need to work together actually, and to spread our MEMAGO message. So it's not only that it's only these countries, we can spread it for everyone. In our MEMAGO region, actually there is no clear data as there is no specialized centers. So most of the data that's been collected is only for hospital-based or let's say centralized based. But of course, the Turkish experience, they have increased their experience in this subject. We're gonna talk about it. So I started to reviewing some studies. So I will not have a fancy slides. I will not have a fancy tables because most of the studies only they are showing some numbers. So just a couple of studies. I will represent some couple of studies. For example, the Tunisians in Salah Aziz Institution. As we can see that they have published one paper around for a patient, 109 patients diagnosed with GTN, and they analyzed this data and they found that it's nearly median age of 34 years old, and around 62% of them, they came complaining of abnormal vaginal bleeding. But interestingly, they used, for the high-risk GTN, they used the French regimen for acetomasine and cisplatin and cisplatin, and the complete response rate with this regimen was nearly 95%. And another study was conducted by the Tunisians, by the medical oncologist. They studied around 29 patients in a period of time of nearly 9 years. And they found that the metastatic disease was reported in 8% of the patients. Metastasis occurred in the lung, mostly in 34%, and then the brain is around 4%. And interestingly, the choriocarcinoma was more diagnosed in their cases. And for Morocco's experience, we can find that they have published a paper around 62 cases about GTN, and they tried to collect it in between the 7 years period of time up to 2021. And we can see that the 10% of GTT, the incidence was from the tumor was 10% from the GTT disease. As 87% of the patients were treated with single-agent chemotherapy. As we know that most of the cases they were low risk, and the high-risk patients cases they were treated with multi-agent chemotherapy around 12%. And we will not forget the Egyptians. The Egyptians actually in Mansour University Hospital, they started to establish, and they newly established a specialized center. And this specialized center is the only one center in Egypt and in North Africa. And they are trying to work with cooperation with international societies. And we can find that they're starting to register some cases. They have around 600 cases being registered and managed under follow-up 42 cases of recurrent mole underwent genetic study. And around 160 cases of low-risk and high-risk GTN being investigated and treated free of charge. They are trying to promote their center. But of course, for example, they published one paper during a period of 1 year, and they found that the GTN, the incidence is around 3.2 per 1,000 live pairs. I think this is not true. It doesn't reflect the true numbers of the country, because you know that it is a referral center, and most of the patients could not be referred for them. It's a bias. And if we go to the Turkish and their experience, actually, this one I just uploaded newly. So sorry for the picture. Before that, they have a society for the Turkish experience. They have a society of GTD society, but it wasn't that much active at the beginning. But now, when they are starting to publish their papers, for example, this paper was newly published before a couple of. It's an e-poster. It was published before a couple of months. They're starting to collect the data because now the system is easier for them. Now all the patients who've been treated in any hospital, private, university hospital, will be registered automatically, and if the diagnosis, for example, it was written GTN, it automatically they can collect the data from there. So we can see that they published this paper newly before 2 months nearly, and we can find that they collected around 1,600 cases of GTD cases, and 5% of these cases, they were GTN, with gestational trophoblastic neoplasia. If we go for the more experienced centers, we can find actually the regional registration system with Heliopolis mole started in UK, Netherlands, and Japan in 1970s, that much before. And we can see that the UK experience, they have 3 screening centers. One in London, and one in Sheffield, and one in Scotland. But only the GTN cases that will be treated in London and Sheffield. For Japan experience, we can see that they are more experienced than the other countries, maybe because they have more cases. They started with 1 center in 1962, and they reached nearly 22 centers in 1992. The data usually they collected, they send it to the so any hospital, any clinic, they treat any case, they directly register it to the nearest center to their hospital. And at the end of the year, they collect these data and they send it to the Japan Society of Obstetrics and Gynecology. So, for example, they collected the data in between 1990 and 2018, and they collected around 1,574 cases. And they found that the low-risk GTN, it was around 15.3 per 100,000 live, and the high risk, it was 3.5. In conclusion, actually, with the development of the internet and the communications, it's easier now. So I think that if we want to start, we can't use for example, the UK experience. The UK, all the cases world in their country, they refer it to the centers. Of course, because they have the health insurance that help them to treat all the cases like this. But in our countries, we have different, I think even in Turkey, in Egypt, we have different health insurances. For example, we have the private, the university, we have the public ones. So still, we cannot refer all the cases to one center. So we can at least collect these data. So we can have a website. So if we cannot manage to do it like the Turkish experience, all the cases, they've been registered automatically by, when you enter the diagnosis of any patients, it automatically will be registered. So they can collect the data easier from us because all their hospitals are connected together in a database. But for example, in our countries, maybe it's difficult, so we can go for like the trial of for the Japanese. For the Japanese, usually they centralize and send it to one center to collect this data. So we can have a website to collect this data. And thank you all, and this is my references.